Omo ka che me say me ko OPD. OPD for so omo so bu nye adwuma. So, I was saying me ko fie.
38-year-old Zila Okine is 9 months pregnant and battling severe stomach pain. She journeyed from Teshi to the Adabraka Polyclinic, desperately seeking medical care. But upon arrival, she met a painful reality. The facility was almost deserted. Nurses, who would have typically been the first point of contact, were nowhere to be found.
Maybe antenatal. But I will be any honomo, and I'm anti information be as we say, baby, say ever coso, till say my baby home.
Her hopes of finding relief were dashed. Tears welled up in her eyes as the pain grew worse, with no one immediately available to help.
Fiti and run on my run is a basically so me banomo in checking, but unfortunately, bedroom animal say no. It will be any animals. I'm feeling me.
I watched her from afar, clutching her belly, pacing and occasionally sitting in discomfort. It became clear she couldn't wait any longer. I stepped in. After speaking to one of the few staff members present at the maternity ward, Zila was eventually ushered in. But that was not the end of her wait. For nearly 20 minutes, she sat quietly before being processed and directed to a consulting room where a doctor finally attended to her.
They've checked me, but they asked me to come and see the doctor. Yeah, so I'm in the queue to see the doctor. I feel okay now. Yeah, I feel better now than before.
The question here is, what would have happened if no one had intervened? How many people like Zila are left in pain with no one to speak for them? This is just one of many cases playing out in health facilities across the country. The outpatient department of the Adabraka Polyclinic on a regular day is very busy. But behind me, just as you can see, the place is virtually empty. Nurses here, like many across the country, have abandoned posts as part of the ongoing strike by the Ghana Registered Nurses and Midwives Association. And the impact here is dire. Patients who would typically rely on this facility for basic health care have been left stranded with no medical staff in sight.
It will last as long as government agrees to implement our condition of service. That's it. We have OPD, withdrawal of OPD and emergency services. That is from 4th to 8th, and after 8th, that is 9th, we are withdrawing all services, including wards, theaters, and all the hospital facilities. What we are saying is we also need to be taken care of. Is it not sad what you be at the emergency and government agency, departments, and other ministries will come and government will pay for them, and you, a nurse, a midwife, will be at a hospital when you are sick, common para, you will need to pay for it.
According to them, this is the 4th major strike action by nurses and midwives in less than 6 years. Strikes were recorded in 2018, 2020, 2022, and now in 2025, all centered around unfulfilled agreements, salary arrears, and poor working conditions. In response, the Ministry of Health has issued emergency directives aimed at maintaining essential healthcare services during the strike. A high-level meeting was held earlier this week where the unions presented a unified demand for the implementation of the 2024 collective agreement, which they claim has yet to be honored. The ministry says it is closely monitoring the situation and is working to deploy logistics and support systems to minimize the disruption. But for patients like Zila Okine, the delay in care is already a heavy burden to bear. As the industrial action continues, thousands of patients are caught in the middle, waiting, hoping, and in some cases suffering. From the Adabraka Polyclinic in Accra, I am Godwin Asidiba, reporting.
As a minister responsible for health, I decided to visit some of these health facilities to have a first-hand information about what is going on. Let me put on record that I am the first person to pursue any reasonable and legitimate consent from any health worker. And I will do just that. Since I took office about 3 to 4 months ago, I've engaged the nurses and midwives groups for more than 6 times within a matter of 3 to 4 months. I have an open door policy, and I'm still willing to engage them at any given time. In fact, I can assure you that even today, I've tried personally to put a phone call to the leadership to still tell them we should still engage. The collective agreement under the bone of contention was inherited, was supposed to have been implemented last year, but I agree that governance is continuum. And so that is why we are ready and prepared to sit around the table and to see how we can implement such an agreement. And so I will continue to appeal to them that in all these matters, what we have to do is to put the patient first. In my humble opinion, I do not think that strike is what will resolve the issue at the end of the day. No matter what, at the end of the day, we need to sit around the table to resolve the matter. And I'm still open. As a leader, it isn't all that I can put out there. It's all that I want to say and continue to appeal to our nurses out there. Sometimes, if you also don't put out the side of government, it becomes one-sided and nobody knows what is going on. And I also have to be circumspect with whatever I put out there. And so with the greatest deal of respect, you cannot handle this health sector without the assistance of our nurses. It's just not possible. They are in majority. Let's face it. But at the end of the day, it is the ordinary Ghanaian, the patient, that suffers. So I'm still calling them. Let's sit around the table and find lasting solution to this particular issue. That is all I can say for now.
Honorable Minister, there are concerns among some of your party communicators that this appears to be political. Is that a position of the ministry as well?
This should not come from the minister. What should come from the minister is what I have said. Whether it is political or non-political, it shouldn't come from the minister.
When will this agreement, the concerns, when can the ministry assure us on when it will be looked at and ultimately addressed?
It is not as if it has not been looked at. We have engaged on several times. Our doors are open and to continue to be opened. And in fact, to tell you, since I came to the office, they themselves, they know the effort I have put in place to resolve other complicated issues with them. This is not the first since I came to the office. So I am committed and ever ready to think through that, even if it has to be unofficial, and I go beyond even my official duties to assist the leadership to maintain and to make sure that there's no tension at their front. This is what I'm committed in doing.
Is the implementation of the agreement as a result of the lack of fiscal space, the reason why maybe the ministry doesn't have enough funds to address the concerns that are raising?
Has the minister said so? These are all your words. What I'm saying is that let's sit around the table, let's discuss, and then with good faith, you sit around the table, you have a discussion, we all stand by it. You don't go and come and change your position on what we have all agreed on. That is exhibition of bad faith. That should not be tolerated. But I am open, and at any given time, I'm open for any discussion until we find an amicable solution to this matter.
You can still go to the police hospital. You can go to the 37 military hospital.
Pacho, good morning. Enra, who say I are for Betimiako 37 hospital, police hospital. Mampacho Ghana. Enya krankwa na ye Ghana. Enye cantonment. Enye 37 hono. Kwa na ye Ghana. Me sure say what ya kra. Obusuafo no bi bu nkra na se. Se bebia ofi no. Ah? Yeah, juma chips compound. Un mama ne aye hu. Chips compound. We juma chips compound. Obi o juma chips compound o ti ho bia. Ebe hu they making. Be ya woka 37 police hospital no. Omo the time na ye juma. Omo nim say okọ juma 7:30. Obepon 1:30. Na nipa no oba awia no abetake here from 1:30 to 7:30 anyway. It's why adwuma 6 hours. Na the next person obeba 7:30 anyway no obepon 7:30 and about 12 hours. We adwuma chips compounder. Unim time opon. That is the worst of chips compound adwuma no. Unni time ye dey pon say o waka cho bi say madam for bi say oh me ko adwuma me pon 1:30 nti about 2 a me share wa say no be ko adwuma na pa be ye opd adwuma be ye we adwuma wi a be about 12:31 no nya labor case labor no ba no 1 cm 2 cm 3 cm until so obewo no wo midwife a watch chips compound pon you Making ebia na pa oba no why your menses unyanka be kofia kodware ebia na pa no na wo ya late nti when did oh ma me nkom ma sesi am pon ma ba didi a whole lot ni nyina aka unti me nye hwe this nipa no awawie nipa no wo wie so a e wo se wo hwe no at least 6 hours. At least, least 6 hours. Do the math. Se nipa no ba 1:30 a opon no kora no bae. No 4 cm mpo. At least 6 cm per hour. Obewo. Until 1 o'clock no kan kosi 6. Fa 6 hours ka ho. Sen. Wa wewie. Wo san betan ho another 6 hours. Kaka ho hwe. Uwie nyina wanyina wie a na ade chi 2 days na watwe 3 days na watwe wo yare a na nyame ampataw nyame ammam na chips compound primary healthcare medication no say bia malaria tablet para ne ade ho nye wo yare no so na sa we so ma memfa me card memfa me insurance card na me nko e bia Mampon Hospital, Tatakwashi Hospital, Minko Kofodia, Ubana. Bibia wusan kutua wade o. Wusan kutua usika nyina. Eka obebo nyina. We na ye ka o. Enu ho asem na ye ka. Condition of service no. Enu ho asem na ye ka why? Na ye ka wabu akola no usan bran su wabu akola no ka chen say munsu. Who does that? De mo ye no enye o. De mo ye no enye utimi da wa anadwo 12 am 1 am madam I me I welcome gidi na wa sorry midwife say edmo chips compound be brena ye BP ebubu scale omo se me boa meka because who need peace of mind who need sound mind the bia you are stressed the bia you are under stressed omo se me boa mo meka ye BP ebubu scale BP because I want no mo o ji awo na nipa no nwo ya it is said there Black Stars for Ebo match na ya share 1-0 and I say ya share ye Ghana for Black Stars for na share 1-0 na omo opponent no ajiri mu aka be 10 minutes e be pon no won say obi aso jeja ho okumeti wakumati we mhye because wonko a o chips company I wanna make an adwo no wonko a midwife no ni client ni pe doctor ni ho orderly ni ho student ni ho rotation ni ho wonko a wodi na awrade obompa o tinu san ka kranka oji awe wi a wasa be clean etu aye this the contaminating instrument ewie etutwe hu nyina ansa tu be wie no na obekọ fia na pa so beda kakra ansa na wakọ adwuma mo obetia na in charge na ye na wasori the bia you are working around the clock enya wo no pe na obeji o bibi the girl makes abeka ho mo amonum no girl makes abeka ho obey stores adwuma obey pharmacy adwuma obey sister uwie na wo yare a wow sika na ide ma na anso no na ese fa bi tuo no odi be bo obra ma wo ma no odi be to ha ma da chi wo ma na so odi be pese jebade bi no wasan kokuru se now de akosa ho yare no wasan betina se no wasan ta be certificate square one enti ma we de ni dim enye akra nko an Ghana mubaya na ya jet mu se ebe eduma okura na se nyina ya transfer na be gukrum na wunua na se wo maame na se wunu wo fa ase no mu a omudo mantimi amba nkran na omo tim kran ase no omo yare a mbefa ka abopo ya moto if you about 37 ni ade abakra decentralization na kan na ase chene sen se nyina ya fa ka mra 37 yebeba na ebe quality healthcare ebenya sa quality healthcare na ebenya nipa nyina kogu na se nurses and doctors na more than 7 police system if they become overwhelmed with work quality no so anya quantity of we ni e kan o quality primary healthcare common malaria what check heredity positive abema malaria treatment no on fa kan 37 nyina beba ho why nyina beba ho de moye no yo
effect of what they are doing is that they are taking patients to ransom and blackmailing government.
Sir.
One, every worker will strike on one. But Yemran and international labor processes makwana efadoko strike. Nurses na adaterfo woka one yefre one essential service providers. When you strike on one, that's the first point. When you strike on one and see, nchishaya emrana yenye de wo hobia order wo National Labour Commission amaniye within 3 days. And me ba sem order National Labour Commission offer mobile wo ho ntentem no sisi se oye na ntasa ma odo ye compulsory arbitration what na wo sisi ntentem na ma oma yefra eyi illegal striking there anama wetu ni nyina otomra ma osei wasam ofide nurse ku bipo onye GNA registered nurses and midwives as onye won court chere de negotiations ni po nkitahudi a wodi aban dada na abredo na rapo kwana wode fado no nda dem nkitahudi na otomra wanfa wona nka ho and multi de ebe negotiator even though nurses and midwives no okita bargaining certificate in other nursing groups are or there you have to accommodate them in your negotiation team. Or there work team no one for one anka ma ono court ebua wokro alternate dispute resolution ma court happen ma offering and registered nurse and midwives association wa bon kaw ma wetua de wa fom now adida boto aban fufuru n'enyim mese woni kwan de work strike na ebe strike so a or there bo National Labour Commission amane notice at least 7 days na bo wo employer so amane de dem na epede eye na oda asam na afofa kwando a onfata National Labour Commission frehon answer na National Labour Commission ba court akaje injunction atward na wa frehon nhima registered nurses and midwives association one call them nhima ma aban na fair wages no nyina wokre one call ono na wode friend injunction atward yi ajen why illegal strike ninti na injunction abeman injunction it is zagora odabia basasa your sleeping place will change nti or there one was wenyim what to won for na woma one actions onye terrorist inclined so see marginal yen red band wo hospital ekasire obi na wo hospital a infra tuntum nko ho ina infra kokko nko ho o wo senti kura o tsedam but baby ala was the red band abo mo wo the hospital administrator say yen there baby ala red band wo sisi ad or the one security for what to ni na wo show na hospital atmosphere oye da yan sabia atmosphere na to the nurses will leaders and make a clear one day I will be ala say Muslim or say Christian o for labor act baby ala Bible dan ma labor act ndaho na wala nkasa yem pensem na bisa wo de e kona anyi nkroforo fadon oye papa na onye papa clearly onye papa and they must get back quickly in the meminda
ya
on said what chan joda wa bra injunction about ordon odo wo yentam was okwadwuma say ento wa terrible but